everyone, and welcome to today's lecture. This video is intended for the fourth year level interns of Southwestern University FINMA. My name is Lessa, and I'll be guiding you through this topic today. For this lecture, we will be discussing about urinary screening for metabolic disorders. Before we start, please get your CM compilation manual, have your ballpens with you, your presence of mind, and please turn it to page 57. So if you are there already, it's time to start. So as you can see there in your manual, we have your topic special urine testing. So to investigate stone formers, we have your urine examination, your serum chemistry, and our stone analysis. Urine examination, serum chemistry, and stone analysis. We have routine urinalysis, and for our 24-hour urine specimen, that is for your sodium, calcium, phosphorus, uric acid, oxalate, and creatinine clearance. For our urine pH determination on a fresh specimen, determines kind of crystal likely to be precipitated. For instance, a pH of 5 to 5.5 acidic sa atong uric acid. And alkaline urine is for the observance of our triple phosphate. We also have serum chemistry to detect serum levels of calcium, phosphorus, uric acid, and electrolytes. And the stone analysis include your optical crystallography, infrared spectroscopy, X-ray diffraction, electron beam analysis, and mass spectroscopy. So let us now proceed to our metabolic disorders. The appearance of abnormal metabolic substances in the urine is caused by a variety of disorders that can generally be grouped into two categories. So, unsa man siya? First is let me erase this one first. So, here, first is the overflow type, and the next one is the renal type. So, ato ni siya tagsa-tagsaon. So, for your overflow type, this is the accumulation of amino acid in blood tungod sa enzyme deficiency. So, in here, in our overflow type, there is an increase of amino acid in blood. Also, there is an increase of your amino acid sa urine. What about for your renal type? So this one occurs secondary to kidney disorders and due to impaired renal tube use. So this time, ang amino acid sa blood, is it increase, decrease, or normal? So in here, normal lang ang level sa amino acid in blood. Ang problema is naa dito sa atuang kidneys. So that is why taas ang iyahang amino acid in urine. So that's how you differentiate the two. So naapod to sa inyuhang table sa Strassinger, naapoy mga examples or classification na gibutang nila dito in a tabular form. So in here, let us proceed with our amino acidureas. So first, let's talk about your phenylalanine tyrosine disorders. Phenylalanine tyrosine disorders. Ang ato ang i-discuss for today, we have your phenylketonuria, alkaptonuria, tyrosiluria, and your melanuria. So let us talk first with your phenylketonuria. So ang kani siya, this is most well-known of the amino acidureas. So atong i-write, most well-known of the amino acidurias, C. Phenylketonuria. So it is first identified by Falling in 1934 when a mother with other mentally retarded children reported a peculiar odor sa urine sa iyahang anak. So, unsa man to na odor? That is your mousy or musty odor. So, mga na siya isa ka mailhan if na ay phenylketonuria ang bata. So, your phenylketonuria is caused by failure to inherit the gene to produce the enzyme. Once a man, that is your phenylalanine hydroxylase. So, ang imuhang phenylalanine, ato ni siyang i-draw diri. Ang imuhang phenylalanine with the help sa ato ang enzyme na si phenylalanine hydroxylase will be broken down into tyrosine. So, ang kani, if wala ang ato ang enzyme na si phenylalanine hydroxylase, maunsa man mo-accumulate sa plasma ang ato ang phenylalanine and your phenylpyruvic acid, as well as our urinary phenylpyruvic acid, phenylacetic acid, and phenylalanine. There is also increase in urinary indole acetic acid and decreased urinary excretion of 5-hydroxy indole acetic acid. So once ma-discover na naa di ay PKU ang bata, dietary changes that eliminate phenylalanine, which is a major constituent of milk, from the infant's diet can prevent excessive buildup of your serum phenylalanine. So thereby can avoid the damage to child's mental capabilities. Kadugayan, as mature na pud ang child, there will be alternative pathways of phenylalanine metabolism na mo develop. So pwede na nato ma-tone down ang mga dietary restrictions. So for the methods of testing, we have your reagent strip, your phenisticks. It detects 5 to 10 mg per dl, and iyahang reagents, please familiarize your ferric ammonium sulfate, magnesium sulfate, and cyclohexyl sulfamic acid. Positive result is gray to gray-green color. We also have for confirmatory testing, for our quantitative confirmatory testing is your HPLC and your Guthrie test for blood. That is your bacterial inhibition test. So, naani siya diri sa likod. So, your Guthrie test, blood from heel is absorbed in paper and blood is placed in culture media with Bacillus subtilis. If naay phenylalanine, kay mo counteract siya sa ato ang beta-2 phenylalanine and inhibits growth of Bacillus subtilis. If walay phenylalanine, so walay mo counteract sa ato ang beta-2 phenylalanine, so there will be positive growth. So balik ta diri. So here, aside from the mentioned methods of testing, we also have testing for ferric chloride. Ang kanisiya, this may be used as a follow-up to ensure proper dietary control in previously diagnosed cases. So, mo niyang ato ang ferric chloride tube test. So, unsaon ni siya pag-perform? First is, we place 1 ml of urine sa tube. Next step is slowly add 5 drops of 10% ferric chloride. Next is the observance of the positive result. So, ang positive result niya, please take note, is a permanent blue-green color. So, this is the positive result of your phenylketonuria in ferric chloride tube test. Permanent blue-green color. Next, let's proceed to the next one. That is your, i-write na to, there is a blank, is your alkaptonuria. So, ang atong alkaptonuria, this is one of the 6 original inborn error of metabolism described by Garrod in 1902. So, alkaptonuria, ang iyahang name, was derived from the observation that urine from patients darkened after becoming alkaline from standing at room temperature. 'Di ba? If makarecall mo, isa sa changes sa atong unpreserved urine is ang pH mo, alkaline siya. So, if naay alkaptonuria si patient, kay once the urine became alkaline, kay mo darken siya. So, unsa may hinungdan ani, this occurs from the failure to inherit the gene to produce the enzyme homogenesic acid oxidase. So, if wala ni na enzyme, ang homogenesic acid kay mo accumulate siya sa blood, tissue, and your urine. So, please also write this one. There is an observation of brown, black, or reddish stained diapers have been reported. So, kana siya, please ko timaan since we will be encountering another na pod later. So, for alkaptonuria, there is an observation of brown, black, and reddish stained diapers have been reported. So, for your methods of testing, naapod tay ferric chloride test. Ang iyahang positive result is transient dark blue color upon the addition of drops of our 10% ferric chloride. So, another test for our alkaptonuria is the silver nitrate test or your homogenesic acid test. So, unsa ang iyahang positive result? That is your black color is seen upon the addition of our 4 ml of 3% silver nitrate and several drops of ammonium hydroxide. So, this is also in your book. Isulat lang po na to ang method on how we perform the homogenesic acid test for alkaptonuria. So, first is we place 4 ml of 3% silver nitrate in a tube. Next is mag-add taog 0.5 ml of your urine. Next is i-mix siya. Then, you add 10% ammonium hydroxide by drops. And the positive result is one is to observe for the characteristic black color. So for our confirmatory test, do not also forget that one, you have your paper or thin layer chromatography as well as our capillary electrophoresis. Let us proceed to thyrocelluria. So in thyrocelluria, the urine may contain excess tyrosine or its degradation products. Unsa man ni sila? That is your p-hydroxyphenylpyruvic and p-hydroxyphenyllactic. It may be due to several causes. So, ang kani siya, atong i-zoom diri na part. So, your transitory type, this is the most frequently seen. And this is due to or caused by the underdevelopment of the liver. So, mo na, ni-occur ni siya sa mga low birth weight and premature infants. Ilang liver is yet underdeveloped. Napod tay hereditary disorders which are classified based on the enzymes affected. So, tulo ni siya. Ang naapa sa inyuhang notes, we have two, but just write the third one sa space na inyuhang makit-an ra diha. So, for your type 1, that is the defect in your fumarate acetoacetate and malay acetoacetate hydrolase. So, mani sa ato ang type 1. So, there is accumulation of urinary succinyl acetone and succinyl acetoacetate. So, that is for our type 1. Ang atuang type 2 kay that is your Richtner-Hanhart syndrome. So, ang iyahang deficiency is your tyrosine aminotransferase. So, there is an accumulation of urinary tyrosine and phenolic acid. So, please kubutang sa inyuhang type 3 sa inyuhang makit-an na space. So, for your type 3, ang iyahang enzyme deficient is your p-hydroxyphenylpyruvic acid dioxygenase. So again, for our type 3, that is your p-hydroxyphenylpyruvic acid dioxygenase. So, ang kaning sa atong type 3 can result in mental retardation if dietary restrictions of phenylalanine and tyrosine are not implemented. So, we have the methods of testing for our tyrosiluria. So, first, that is your nitroso naphthol test. For our nitroso naphthol test, ang iyang positive result, if mag-refer ta sa ato ang stress, is your orange-red color. Orange-red. But other answer also is your soluble red complexes. So, maunang na siyang isulat. Next one, we have your Milon's test. So, for your Milon's test, it produces a red color in the presence of tyrosine p-hydroxyphenylpyruvic acid. But naalang ni siya disadvantage kay it contains mercury, which is toxic. And we also have for confirmation that is your chromatography. Let us proceed to the next one. So, ang atuang tyrosine, duha na pod siya lain pathway. So, ang second metabolic pathway for our tyrosine, butangin nato diri, second metabolic pathway for tyrosine. Sa to ang tyrosine. Ang ganiha mo to siya ang first pathway. So, for second metabolic pathway for tyrosine, it is responsible for melanin, thyroxine, epinephrine, protein, and your tyrosine sulfate. So, among ana nila, ang major concern ani if we will be talking about sa ato ang urinalysis kay si melanin. So, that's why arita mo focus. So, ang atong melanin, this is the pigment responsible for the dark color of hair, skin, and eyes. So, unsa may mahitabo if there is or unsa ang tawag sa sakit if there is a deficient production of melanin. So, unsay tawag ana niya? It will cause your albinism. So, elevated urinary melanin is a serious finding which indicates your unsa man malignant melanoma. Ang kanina tumor, kani ato ang malignant melanoma, will secrete a colorless precursor of melanin. So, unsa man na iyahang colorless precursor? That is your 5,6 dihydroxyindole. So, it will oxidize to melanogen and then to melanin, producing a dark urine. So, mao ni siya nahitabo ani in your melanuria. So, ato ang malignant melanoma, mo-secrete siya colorless precursor sa ato ang melanin, si 5,6-dihydroxyindole. Mo-oxidize ni siya to melanogen and then to your melanin, producing a dark urine. So, si melanuria, mo-darken ang urine after exposure to air. On the other hand, ato ang alkaptonuria, mo-darken ang urine after it became alkaline. So, ayaw mo kalibog ana nilang duha. So, for our method of testing, we have your sodium nitroprusside or nitroferricyanide, which produces a red color, positive result. So, this one next is your, please write, ferric chloride. That is your ferric chloride. So, unsa ang iyahang color sa ferric chloride test? That is your gray-black precipitate. And you also have your Ehrlichs. So, ubay-ubay na to ato ang gitest no sa ferric chloride. So, please co-remember sa mga positive results. Now, we are on to our branch chain amino acid disorders. So, ang atang i-tackle diri is we have your MSUD or your maple syrup, urine disease, and your organic acidemias. So, ari sa ta sa ato ang organic acidemia. So, your organic acidemia, the three most frequently encountered kay si isovaleric, propionic, and methyl malonic acidemia. So, if maka-recall, unsa ganito ang ato ang characteristic urine odor ani niya, that is your for organic acidemia is sweaty feet odor. So, now let's talk about your MSUD. So in our MSUD, or your maple syrup urine disease or disorder, there is an increased urinary excretion of your leucine, isoleucine, and valine. So ako ang palatandaan ana niya is LEVA and their corresponding keto acids. So this is due to the failure to inherit the gene for the enzyme necessary to produce oxidative decarboxylation of these keto acids results in their accumulation in the blood and urine. So unsa man ang ato ang characteristic odor sa MSUD, if you can still remember, that is your maple syrup, caramelized sugar, or curry urine odor. So the urine screening test for our MSUD, you have your dinitrophenylhydrazine tests, or your 2,4-DNPH. So it indicates presence of alpha keto acids in the urine. So ang iyahang procedure is you add 10 drops of the reagent to urine. So ang reagent na to is your dinitrophenylhydrazone plus your 2-NHCl. And ayaw kalimot sa iyahang positive result, that is your yellow or chalky white precipitate. Or if makita ninyo sa Strassinger, yellow turbidity. So kana na siya, or yellow precipitate. So for our gas or thin layer chromatography, we have your nuclear magnetic resonance spectroscopy. So next one, let us now proceed to our tryptophan disorders. So ang atong i-talk about ani diri na mga disorders are your first indicanuria, and second is about sa ato ang 5-hydroxyindole acetic acid. So diri sa atas sa ato ang, please write, indicanuria. So normally, most of the tryptophan that enters the intestine is kanina siya normal metabolism. Mostly daw sa ato ang tryptophan na mo enter sa ato ang intestine is either reabsorbed for use, or unsa man converted to indole by intestinal bacteria and is excreted in the feces. So however, in certain intestinal disorders, which is makita nato diri pod, including your obstruction disease, your presence of abnormal bacteria, malabsorption syndrome, and heart-nap disease. So unsa may mahitabo ani? There is increased amount of tryptophan that are converted to indole. So if naa ka ani mga sakit diri, like aning heart-nap disease, mga obstruction, malabsorption syndrome, mo increase daw ang amount of tryptophan that can be converted to indole. So daghan pod siya indole na ma-produce. So unsa may buhaton sa, or unsay mahitabo di ay sa ato ang excess indole. So this one, ato ang excess indole kay atong excess indole kay maunsa man siya reabsorb sa intestine. I-reabsorb sa intestine, then moadto siya sa bloodstream. After that, moadto ni siya sa liver, then dito i-convert to indican. and this one will be excreted sa atoang urine. So ang kani atoang indikan, this is colorless. So ibutan nato diha si indikan kay colorless unless ma-oxidize to the dye indigo blue by exposure to air. So si indikan colorless ni siya nya maihi through the exposure of air mao nang mahimong indigo blue ang color. So that is why early diagnosis of heart nap disease is the observation of the characteristic blue diaper syndrome. So please ko timan ana. So for the methods of testing, we have oxidation when exposed to air kay ang colorless urine mahimong blue, and sa ferric chloride test kay deep blue or violet ang iyahang positive result. Next one, let us proceed with our 5-hydroxyindole acetic acid. So ang kani siya, involve the second pathway of tryptophan metabolism and ang iyang i-produce kay si serotonin. So, asa man day nikikan ang ato ang serotonin. So, ato ni siyang apelon since nagawas na pod ni siya sa boards. So, serotonin is produced by the argentaphine cells in the intestine. And this is carried through the body primarily by the carried by the platelets. So normally, ang atoang serotonin is gamiton sa body and only small amount sa iyahang degradation product. Yang degradation product that is your 5-hydroxyindole acetic acid. Maura na siya narigamay na ma-excrete sa urine. However, if naay argentaphine tumors, si patient, unsa man ang mahitabo. So, there will be excess amount pod of serotonin na i-produce. So, of course, taas pod ang ato ang 5-hydroxyindole acetic acid sa urine. So, pila di ay ang normal daily excretion of 5-hydroxyindole acetic acid, that is 2 to 8 mg. So, excretion of greater than 25, imagine taas ra kayo, mg per 24 hour can be an indication of argentaphine cell tumors. So if taas na kayo siya, maabot na siya greater than 25 mg per 24 hours. So this is seen in your argentaphine tumors as what we have stated a while ago. So for the methods of testing, we have your nitrosonaphthol test. Positive result is purple to black color. So if mag-collect the sample for our 5-hydroxyindole acetic acid, dietary instructions should be given. Kay naamang good tayo mga certain foods na rich in serotonin. So iwasan sa ni siya kay pwede siya makakause og false positive. Unsa man ni siya ng mga pagkaon that is rich in serotonin, your bananas, pineapple, and your tomatoes. Aside from that, dapat mag-withhold pod ani na medication for 72 hours. So that is unsa man na medication, your phenothiazines and your acetanilide. So that's it for our 5-hydroxyindole acetic acid. Now let us proceed with our cysteine disorders. So we will be tackling about your cystinuria, cystinosis, and homocystinuria. So in your cystinuria, from the name itself, there is elevated ang cysteine sa urine, cystinuria. So the presence of increase in urinary cysteine is not due to the defect in the metabolism of cysteine, but the inability of the renal tubules to reabsorb cysteine filtered by the glomerulus. Mao ni siya ang reason moong ni gawas ang atoang cysteine sa atoang urine. So there are two modes of inheritance sa atoang cystinuria. So ato isulat diri since wala man pud ni siya na separate sa ato ang notes. So please write ari sa ato ang cystinuria. Cystinuria. So sa ato ang cystinuria naa siya'y two modes of inheritance. So unsa man ang iyahang two modes of inheritance? So first, ang ma-affect is the reabsorption of kanina amino acids. Your cysteine, ornithine, lysine, and arginine. So the reabsorption of your 4 amino acids kaning cola, cysteine, ornithine, lysine, and arginine is affected. Unsa man ang other mode of inheritance, only cysteine and lysine are not reabsorbed. So please ko temaan ani nila. Next one, what about our cystinosis? So for your cystinosis, kani siya is your uninherited inborn error of metabolism. So this is due to the defect in the metabolism of your cysteine. So ibutan na to diri inborn error of metabolism. So in your cystinosis naapod siya'y lahion na nato og color. Two general categories. So the two general categories are, first is your nephropathic and the second one is your non-nephropathic. So ang ato ang nephropathic can be categorized papod into two. So your nephropathic, ilisan na ni nato siya og color. Kani. It can be infantile. So in infantile, there is a rapid progression to renal failure. Rapid progression to renal failure. What about your late onset? So in your late onset, there is a gradual progression to total renal failure. So mao na siya ang atoang categories of your nephropathic cystinosis. So let us now go with the methods of testing. So first, we have your cyanide nitroprusside test. So unsang iyahang positive result? That is red purple. So, naalang siya interference. It can cause false positive sa atoang ketones and homocysteine. So, please remember that. So, now we will be talking about our homocystinuria. So, in the homocystinuria, defects in the metabolism of the amino acid, ang atong i-write lang diri ang katong amino acid methionine produce an increase in homocysteine in the body. So if naay defect sa metabolism sa atoang methionine, mutaas daw ang homocysteine throughout the body. So ang kani siya ang methods of testing pod nato for homocystinuria, as you can recall kay positive pod siya sa cyanide nitroprusside and the positive result is red purple. So since positive ni siya ani, an additional screening test is performed, which is your unsa na test, that is your silver nitroprusside. So in your silver nitroprusside test, this will only react positive for our homocysteine. So unsa man ang iyahang positive result, please correct that is please correct that is your red purple. Mo ni siya ang positive result. And lastly, we also have your electrophoresis. So now let us talk about our porphyrin disorders. So this is the abnormality in the basic pathway for your heme synthesis. So the blockage of a pathway reaction results in the accumulation of the product formed just before the interruption. So ang solubility sa ato ang porphyrin compounds, it varies with their structure. So please write this one. So ang kani solubility, i-write na nato diha. So ang most soluble, since soluble siya, of course, it will readily appear in the urine. So that is your aminolevulinic acid, your porphobilinogen, and your uroporphyrin. So, mo ni siya ang most soluble. So, what about your less soluble? Pero kani siya kay makita gihapon sa urine. Less soluble pero makita gihapon sa urine, that is our coproporphyrin. And what about that is not seen in urine? That is your protoporphyrin. So please take note of this one. Most soluble and makita sa urine, less soluble but still makita gihapon sa urine, and ang dili makita sa atoang urine. So in here naapod screening test. We also have our screening test for lead poisoning. So if you can recall, unsa to siya, ang screening test for your lead poisoning, which is recommended by your CDC, is the analysis of whole blood for the presence of free erythrocyte protoporphyrin or FAP. Again, ang CDC recommended analysis of whole blood for the presence of free erythrocyte protoporphyrin is our screening test for lead poisoning. So the disorders of porphyrin metabolism, they are collectively termed, unsa ang tawag nato sa ilaha, they are termed as your porphyrias. Kani siya, porphyrias. So they can be inherited or acquired. So common causes sa ato ang acquired na porphyria. So here, i-write sa ani nato. Acquired common causes, please correct sa ato ang acquired porphyria. So, we have your kani siya naa diri lead poisoning. Another one is your excessive alcohol intake. Another one is your iron deficiency. We also have our chronic liver disease and your renal disease. Mani siya ang ato ang common causes of your acquired porphyrias. So your inherited porphyrias kay mas rare and they are caused by failure to inherit the gene that produce an enzyme needed in the metabolic pathway. So na tabular form diri sa atong common porphyrias, ato sa na siyang balikan later. So in here, the possible indication for our porphyrinuria, that is unsa man, your port wine colored sa ato ang urine. So for the screening test, we have your ultraviolet light from your Woods lamp, which detect uroporphyrin, coproporphyrin, and protoporphyrin. So another screening test is the Ehrlich's reaction. So it detects your aminolevulinic acid and your porphobilinogen. So in here na nata sa ato ang mga common porphyrias. So ato ang mga inherited porphyrias magka port wine colored ilahang urine. Pero ang porphyria nato na dili port wine colored or colorless ilahang urine, that is your lead poisoning. So here for your porphyria, we have the elevated compound, the clinical symptoms, and your laboratory testing. So usually manggawas ani nila is the elevated compound. So we have here mnemonics to help you remember kung unsa ang elevated compound sa mga certain porphyrias. So first is your acute intermittent porphyria. So that is your ALA porphobilinogen. So how to remember acute? So cute mo pala. So pala is ALA porphobilinogen. So next one we have for our erythropoietic protoporphyria is PrEP. So PrEP, unsa man ning PrEP, that is your protoporphyrin dayon erythropoietic protoporphyria. So what about the next one is your congenital erythropoietic porphyria. is elevated compound niya kay uroporphyrin o coproporphyrin. So ato ang palatandaan ana is coconut. So congenital coproporphyrin and your uroporphyrin. So what about your porphyria cutanea tarda, that is uroporphyrin? So ang ato ang palatandaan is for you. Porphyria niya, cutanea tarda, then uroporphyrin. What about your variegate porphyria? That is your coproporphyrin. So variegate var coproporphyrin ko. So para dili ta kalimot, you can use this cute mo pala. I'll prep coconut for you sa var ko. So I hope that will help you memorize kung unsang elevated compounds sa atong certain porphyrias. Aside from that, please also memorize or familiarize the clinical symptoms. So it can be photosensitive, neurologic, or psychiatric, or both. Kay this has also been asked in your board exam. So please also na lang po familiarize sa ato ang laboratory testing. So that's it for our porphyrias. Now let us proceed with our mucopolysaccharide disorders. So this is an abnormality involving the glycosaminoglycans. So we have your different types of we have many types of our mucopolysaccharidosis. But ang best known ani nila is your Hurler, Hunter, and your Sanfilippo syndrome. So in here, you can write this table kanina sa ubos in a space na diha sa inyuhang notes or sa inyuhang compilation manuals. So for your Hurler and Hunter, the skeletal structure is abnormal and there is severe mental retardation. Si Hurler o si Hunter. So sa San Filippo, ang naalang niya, the only abnormality is mental retardation. In addition, for your Hurler, mucous polysaccharides accumulate in the cornea of the eye. Then for your Hunter, it is inherited as sex-linked recessive and rarely seen in females. So let us now go to the methods of testing. So for your screening test for our mucopolysaccharide disorders, you have your CTAB or cetyl trimethyl ammonium bromide turbidity test, acid albumin test, and metachromatic staining spot test. For your CTAB and your acid albumin test, ang ilang positive result is naa sila'y thick white turbidity. So ato ang isulat diri for your CTAB, it has here, thick white turbidity after, please take note, 5 minutes. What about sa ato ang acid albumin test? Na siya thick white turbidity after 30 minutes. So mo anay kalahian nilang duha. And in your metachromatic staining spot test, the positive result is a blue spot that cannot be washed away by a dilute acidified methanol solution. So next one, we have our carbohydrate disorders. So you can write this sa space na makita ninyo diha sa inyuhang compilation manuals. So for your carbohydrate disorder, isa sa important na dapat ninyo mahibal-an is about your galactosuria. This is the inability to properly metabolize galactose to glucose. So it can be caused by a deficiency in any of the three enzyme. So first nato is your galactose galactose 1, phosphate, uridyl transferase, or GALT. So that is the first deficiency. It causes severe, possibly fatal symptoms associated with galactosemia. So kani siya, among sa three, siya ang pinaka grabe. So next one is we have your galactokinase, and it can result in cataract in adulthood. Next one is your UDP galactose 4 epimerase, which is asymptomatic or produce mild symptoms. So please take note of these three. So early detection sa ato ang galactosuria followed by removal of lactose from the diet can prevent these symptoms na naa diri sa inyuhang notes. So you have your calciuria. Iyang test is Sulkowicz test, which is for qualitative measurement. The positive result is turbidity. Please kotimaan sa reagent, which are your oxalic acid, ammonium oxalate, and glacial acetic acid. For your chloride, we have your Fantus test, which is semi-quantitative test with the reagent of aqueous potassium chromate, aqueous silver nitrate. So, here the procedure is we add 1 drop of aqueous potassium chromate plus drop by drop of aqueous silver nitrate. Then you observe your color change. And number of drops of aqueous silver nitrate is equals to the grams of your sodium per liter of urine. Next is we have your melanuria. We have please read what is in the notes, and we have talked about that a while ago. So next is for your purine disorder. So here please na lang sad ko write ani sa inyuhang sa inyuhang compilation manuals. So for your purine disorders, we will be talking about our Lesch-Nyhan disease. So it is a sex-linked recessive which results in massive excretion of urinary uric acid crystals. So this is the failure to inherit the gene to produce the enzyme hypoxanthine guanine phosphoribosyltransferase transferase. Again, enzyme deficient anemia is your hypoxanthine guanine phosphoribosyl transferase. So the first sign is often uric acid crystals resembling, take note, your orange sand in diapers. So daghan naman kayo ta siya mga diaperism na atuang naagian a while ago. So here, this is palatandaan which is also helpful to our visual learners on how you will remember kung saan na to pag hinumdum kinsa man tong orange, kinsa tong blue, kinsa ning black. So here, para to help you remember, so orange sand in diaper, that is your Lesch-Nyhan syndrome. So palatandaan is less so ng orange. What about your alkaptonuria, 'di ba? It causes ang observation of your brown, black or reddish stained diaper. So para di ta kalimot asa ato, you can use the palatandaan kung kinsay hilig diri og alkapon, kinsay hilig diri og donut. So pwede ninyong palatandaan si brown alkapon. So what about our heart naps disease? So pwede ninyong himong palatandaan ana is your blue heart. So I hope that will help you remember sad sa ato ang mga different diaperism in cm. Kumbaga. So here, if you want again for additional readings, you can check your Branzel. We also have our review compilation notes ang inyong ginagamit today and your Strassinger if naamoy gusto pa na mabasahan aside from what is in your notes and what is discussed for today. So again, if you have questions and clarifications, you can ask it to me during our rationalization during didacts. So before we end this session or this lecture, let me leave another quote, and kanina siya na quote ang murag ni pop up ra gani ni siya og galit while I am reviewing for my board exam. So let me share it to you. So it is do not be afraid, just believe. So Mark 5:36. Mubo ra kayo ni siya but comforting kaayo. Kay of course, if mag-take kag exam, mahadlok jud ka. Kay magunsa na ko, what if mo fail ko, what if dili na ko mabuhat. So daghan kay tag kanang kuan kahadlok. And if mahadlok ka, isabiya na sa reason mo nang dili ka makapass is because naa kay kuan kanang nahadlok ka palang daan bisan wala pa ka nakakita sa exam. So if nahadlok na ka daan, dili na maka-concentrate imong mind, dili na clear imong mind. So ayaw kayog padala sa hadlok and just believe that you can. Just believe sa imong natun-an. Believe in yourself. So manifesting with hard work and prayers. And yes, you will get that 3 letters, hashtag RMT. Laban.